Good evening. Dino Chavez. 25 years of experience in health insurance. Have my MBA in finance. I'm proud of that. So I'm good with numbers. And I think I was here at your last meeting to talk to you, and I asked you to please look at claims cost. I do represent Aetna. I represent Blue Cross. I represent United Healthcare. And I represent a multitude of different carriers out there besides the ones that are bidding. However, I'm not a bidder in this instance, just like I said last time. So I feel comfortable talking about what I'm going to tell you. I see a bunch of red flags, really, to the process. One was that employees didn't get an opportunity in an entire group to look at it because it was rushed through during the summer vacation. However, if the ones that were there gave their opinion, okay, they gave their opinion. And obviously you all looked at it, and so you have your opinions as well. However, how many of you looked at comparing claims cost? When I was here last time, I told you that the biggest portion of the cost of your plan is your claims, right? You pay for TPA costs, you pay for prescription drugs, you pay for your stop loss, but the biggest portion of your plan is your claims cost. So the rational thing in me would say, well, how about just comparing the top 4 companies that you have here and get them to give you the top 20 things that BISD employees go to the doctor for, okay? You look at the top 20 things and you compare them back to back to back. Now I get a semi-representation of who is going to affect my bottom line the best. Not who has the most doctors, not who has the best or cheapest rates for their TPA, but on the biggest portion of your plan, which is your stop loss, who is going to save us the most money? I know I only have 5 minutes, so I'm going quickly. I do have a full report. If anybody would like to see it, they're out in my truck. I'll gladly give it to you. In June of 2017, the Congressional Budget Office came up with a sampling of how much people were being charged as compared to Medicare. So we have Medicare being accepted by hospitals. We have private insurance being accepted by hospitals. There's a local hospital group here who I analyzed, and I look at their annual report. According to the report, there were approximately 28% of their patients that were Medicare patients and about 28% that were private insurance patients. However, when you looked at their cash flow, 49% of their cash flow was derived by private pay insurance patients. What that means is that private pay insurance patients are paying much, much more than if you were to walk in the door with Medicare. So why is it that we can't pay Medicare rates where 28% of the population submits Medicare and they take it, but private insurance companies, like you all have, we are going to have to pay at this rate of pay? It just doesn't make sense to me financially. So I looked at it even further. I looked at the RAND report, the RAND Corporation report, which was done this year, 2019, and they looked at the Tenet Corporation, and they looked at the HCA Corporation. They looked at a bunch of different corporations that have to do with hospital. HCA is Valley Regional, and Tenet is Valley Baptist. Those are the ownership companies. According to this research, the Tenet Corporation, for anything in network, they're charging 201% of Medicare. For anything out of network, they're charging 230% of Medicare. HCA Hospitals, Valley Regional, is charging 244% for anything in network or for anything that's inpatient, and 429% for something that's outpatient. So just think of those numbers. And I have the full reports that you could read it with your own eyes to reflect back on those things. So I said, what if the district paid it at the Medicare rate versus at the rate that we're paying now? How would that affect our bottom line? The savings just in hospital, meaning only if we shifted the hospital people, just our hospital claims to the Medicare rates, we would be saving $14.5 million per year. Not $200,000, not $1 million rebate, not a rebate here and there. We're talking about $14.5 million in difference. That $14.5 million, interestingly, I thought, and I said, If you had just eliminated employee contributions for everybody, that would cost your district 1.1 million. If you eliminated or you reduce your deductible, that from 750 down to 250, that would cost you 3.9. So those two options would cost you 5 million, but you would have 14 million to play with. And for anybody who would like more information on this, please feel free to call me. I think most of you have my phone numbers. I'm available after the meeting or tomorrow or the next day. Thank you.
Thank you, sir.